Here is Middle East Respiratory Syndrome. Middle East Respiratory Syndrome first came about in 2012 in Saudi Arabia. Since then, there have been positive tests in 27 countries. In May of 2014, positive tests occurred in the US. Two healthcare workers who both lived and worked in Saudi Arabia and had no link to each other. Both tested positive, were hospitalized in Saudi Arabia, and then transferred to the US, where they were later discharged and made a full recovery. Here's a graph from the New England Journal of Medicine of all of the cases of Middle East Respiratory Syndrome globally, with Saudi Arabia having the most at over 1,000 cases. And here's a graph of the cases worldwide since 2012. After some studies, they found that this originates from camel nasal secretions in urine who carry the infection. The incubation period they found was 5 to 7 days and even up to 14 days. They found that it is transmitted through humans via close contact. Some of the further pathophysiology is that lymphopenia has been found in patients who tested positive, and there's no lab testing currently available. They can do a polymerase chain reaction test at state health departments and the CDC, in some cases worldwide. Here's another image from the New England Journal of Medicine, and that bottom figure is showing you some of the effects of gas exchange in the alveoli and how the infection begins in the bloodstream with that airborne contact. In the top right, you'll see the ecology of transmission as well. Here are some of the signs and symptoms that they're aware of. It's going to include some flu-like symptoms, including fever, cough, dyspnea. Acute respiratory distress syndrome has been found. GI symptoms are not excluded as well. And also recent travel is one of the bigger indicators, as well as contact with camels. As far as patient management, right now there's no specific antiviral medication or vaccine to be administered. And in and out of hospital, in pre-hospital, there is no specific guidelines for treatment. The main thing you can do is focus on relief of symptoms and supportive care, as well as be concerned for your own safety and taking precautions. As far as contact precautions, it's pretty similar to what you see at both pre-hospital and in-hospital, and taking the standard gown and gloves for contact precaution, and as well as airborne precautions like we do with COVID-19, and providers are generally at a low risk of developing Middle East Respiratory Syndrome.